Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Varun Bhatia. Currently, I'm working in Aster MedCity as a structural heart interventionalist. I have done my fellowships in structural heart, basically in TAVI from Budapest in Hungary and from Toulouse in France. So today we are delving into a silent epidemic that India is combating, that is heart failure. In India, majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence in to witness young adults seeking medical assistance for heart failure, unlike the Western countries where heart failure is predominantly a disease of elderly. Let's break down this into five essential insights of heart failure. Firstly, what does it mean when the doctor tells you that you have heart failure? When people get a diagnosis of heart failure, they think it's the end of their life. The term heart failure can seem frightening. It simply means your heart is struggling to pump blood as efficiently as it should. The ejection fraction, the EF, measures how well your heart pumps blood. It is the amount of blood that is pumped out of your heart, lower chamber, at the ventricle, each time it contracts. While a normal EF is around 50 to 70%, individuals with heart failure typically have an EF of 30% or lower. Secondly, why are so many Indians affected by heart failure? Genetics plays a significant role here. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, and smoking habits worsen these epidemics. Moving on, what are the signs and symptoms of heart failure? Watch out for confusion, fatigue, heart palpitations, nausea, shortness of breath, weakness. There is also loss of appetite or vomiting. How can we protect ourselves from this disease? Our hearts work incredibly hard to keep us alive. There are some five golden rules that we can follow to return the favor. Early detection of heart failure through regular blood tests, dietary adjustments to maintain a heart health, incorporating daily exercise into your regime, practicing stress management techniques, and quitting alcohol, tobacco, and smoking. And lastly, the fifth point, what comes next after a heart failure is being diagnosed? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and a productive life even after the diagnosis. Heart failure medication, improved quality of life and longevity. Devices which have come up like biventricular pacing, ICD, implantable cardioverter defibrillator, and heart valve repair or replacement. And a last thought treatment option is heart transplant, which is definitely feasible. The lifetime risk of congestive heart failure is 1 in 5 in both men and women. Remember, awareness and proactive measures are key in combating this silent epidemic. Thank you.